In this video, we're going to talk about three things. One, what is Lumify? Two, how does Lumify work? And three, when should you not use Lumify? When should you not use Lumify? Well, before answering that question, let's talk about what Lumify is. Lumify is a medication sold over the counter without a prescription, and the indication is to decrease eye redness or get rid of eye redness or make your eyes look less red. The compound that's in Lumify is a medication called Brimonidine. Now, Brimonidine is interesting because we've used Brimonidine for decades to treat patients who have glaucoma. And when I first heard of Lumify, I was a little bit skeptical about it decreasing eye redness because Brimonidine can often cause eye redness. And in some people, this can actually be quite severe. They can develop an allergy to Brimonidine, where even just a few doses causes their eyes to become red and inflamed. And the interesting thing about a Brimonidine allergy is that it can occur after someone's been using Brimonidine for many, many years. And then, for whatever reason, they develop an allergic reaction to it and can no longer continue using it. But nonetheless, Lumify now has been on the market for many years, and it is quite effective in terms of decreasing eye redness and making your eyes look more white. The way it works is that it is a much lower concentration of Brimonidine. It's Brimonidine 0.025 as compared to the dose that's used in patients who have glaucoma. In patients who have glaucoma, the concentration of Brimonidine can vary from 0.1 to 0.2. So the dose in patients who have glaucoma is actually 4 times as concentrated, or sometimes actually 8 times as concentrated as the dose that's in Lumify. So it turns out that Brimonidine in low doses actually causes vasoconstriction. It causes the blood vessels in the surface of the eye to become constricted or thinner and thus less visible. If you can't see the blood vessels in the surface of the eye as well, then the eyes do look less red. They do look more white. If we look at the data that was submitted to the FDA to get Lumify approved, they conducted 2 studies, each of them with about 50 or 60 patients, and they compared patients who used Lumify or Brimonidine 0.025% compared to a vehicle, a placebo, an eye drop that really didn't have any medication in it. And they looked at the degree of redness between the two. And if you look on the graph, you can see the line with the circles were the patients who had Lumify. And you can see that they had decreased redness at all time points. And this is out 240 minutes. So that means, looking out 4 hours after installation. And the difference was what we call statistically significant across all time points. And they went on to look at 6 hours and 8 hours and found that even at 6 hours and 8 hours, there was a significant difference in the amount of redness in patients who use Lumify versus those who use the placebo. So Lumify is indicated to decrease eye redness, and that can last up to 8 hours or perhaps even longer. So it is sold over the counter without a prescription, and many of my patients use it, and I have no problem with them using it. The issue does come up though, and sometimes that there are patients who do have a Brimonidine allergy, and they use Lumify. So the Brimonidine allergy makes their eyes look more red, and they use Lumify in hopes of making their eyes look less red. But really what they're doing is adding gas to the fire. They're already using Brimonidine, it's making their eyes more red, and then they're putting Lumify or more Brimonidine on top of that, and it's not making their eyes any better. In fact, it's making it worse. So where it becomes a problem is when the diagnosis of a Brimonidine allergy is not made or it's missed. And so these patients will have red eyes, and they will continue to use Brimonidine, and then they will also use Lumify. And when they come in, they're prescribed steroids for the redness, but the steroids don't treat the redness because they're still continuing to use Brimonidine. So that can be a problem. And so the steroid can actually sometimes raise the pressure. And so they're prescribed more glaucoma drops, which then cause more redness, and it can become a vicious circle. So if you see a patient who's on Brimonidine and their eyes are red, or if you are a patient who's using Brimonidine and your eyes are red, consider a Brimonidine allergy. It's not super common, but it's also not rare. So to bring this back full circle, when should you not use Lumify, or when does Lumify not work? Well, it certainly doesn't work if someone has an allergy to Brimonidine. We should always consider that when patients who have glaucoma come in with red eyes. A Brimonidine allergy is actually relatively easy to diagnose. The conjunctiva and the skin around the eyes has a very characteristic appearance with Brimonidine. And it's important in these patients that we not use Brimonidine anymore, and that we also not use Lumify, of course. But in general, outside this specific subset, I've found Lumify to be very effective in terms of decreasing redness, and patients are very happy with it and they continue to use it. And the effect can last for 8 hours, sometimes more. Today, you've learned about Lumify, what Lumify is, how it works, and when not to use Lumify. Did I mention that I wrote a patient guide about cataract surgery? You can find the link to the book in the comments below. Follow this channel for more information about eye health. Have a great day.